Psoriasis. What is? And how to treat it? Psoriasis is an autoimmune disease, a chronic disease, where the skin is affected by the accelerated growth of skin cells. As a consequence, red spots may appear on the skin covered with thick, silvery scales. Also in the affected areas you can see a dry and cracked skin that can bleed. The lesions may also be itchy, burning, and painful. There are several types of psoriasis, and in the most aggressive, swollen and stiff joints are very common. Psoriasis patches can range from a few scaly, dandruff-like spots, commonly seen in children and in mild cases, to major rashes that cover large areas of the skin. Psoriasis can start with very mild symptoms, and the best doctors can mistake it and initially diagnose it as seborrheic dermatitis, which only presents redness on the scalp and around the ears. Until this redness and swelling is present on the elbows, knees, or lower back, psoriasis can be misdiagnosed unless a skin biopsy is performed. There are triggers that affect the appearance of accelerated growth of skin cells, such as stress, overweight, obesity, and even genetics can be a precursor to this inflammatory disease, which can also cause internal diseases in the digestive system or the joints in the form of arthritis. Most types of psoriasis have cycles, meaning they usually come and go. It happens that they start with flare-ups that last weeks or months and then subside or even go into total remission. Since there is still no cure for this disease, the way in which specialists recommend controlling the symptoms is with measures related to lifestyle, such as obtaining a healthy weight, following a healthy diet, finding ways to release stress, and perform frequent physical activity, as well as eliminate unhealthy habits, such as the consumption of alcohol and tobacco. Palliatives in topical cream, pills, soaps or other forms are usually quite useful for less aggressive cases, but when it comes to psoriasis such as pustular or erythrodermic psoriasis, which are capable of causing large wounds or skin lesions, and arthritis in the spine or joints, a more appropriate treatment is the consumption of biological medicines, or the application of phototherapy, which consists of exposing the lesions to ultraviolet radiation. The application of biological medicines and phototherapies are very effective depending on each case, to the point of stopping the progress of the disease and restoring mobility to the joints. The problem is that patients may require it in fortnightly or monthly doses, and since they are very expensive drugs, they are difficult for many people to afford. Patients with psoriasis also fight against the stress and anxiety caused by this disease, which, although at first it seemed to only bother them aesthetically, affects them painfully and costly, causing deeper discomfort. The emotional one. Although the symptoms, in mild cases, can be controlled through medication and other treatments, really, it is a healthy lifestyle that favors the reduction of inflammatory conditions, in a disease that attacks various areas, and negatively affects the quality of life of people's lives. And well friends, this was all for today. Don't forget to take advantage of these tips in your daily life. If you liked this video, give it a like, subscribe and hit the bell, so they can know when we have uploaded a new video with another interesting topic for you. Greetings, here was Mons from Actual Life. Until a next video.